My name is Rachel Carnes, and this is my health assessment video for Nursing 320. My patient today is DM. She is an 86-year-old female, and she's here today for an annual physical exam. Hi DM, my name is Rachel.
Hi sweetie.
I'm going to be your nurse today. So you're here today for a physical examination?
Yeah.
All right. So as I'm assessing Mrs. M, I'm just looking at things like her ability to communicate with me. Clearly she can hear me talking at my normal volume. She speaks appropriately, answered my question. Her speech is clear. She looks like she has good nutritional status, and her hygiene is very good. So we're going to continue on. The first thing I'm going to do is just look at your hands. Her skin is warm and dry and pink. Her fingernails look good. Capillary refill is immediate. And check her skin turgor, which is just a little sluggish. And I'm going to feel your pulse if you just want to let your arm relax. And I'm just going to be counting. So your heart rate was 68, and you had 16 breaths per minute. So next thing I'm going to do is take your blood pressure. Okay, you can roll your sleeve up for me. And it's okay to use this arm?
Yep.
And just nice and straight, I'm just going to feel your brachial pulse. Good and strong. /104/72.
Oh my goodness, boy, I'm getting good.
And then I don't have a thermometer, but my next step would be to assess her temperature. So I'm going to start evaluating. I'm just going to start at your head and work our way down to your toes. So the first thing I'm going to do is just inspect your scalp and your hair. Temporal arteries. Good. And then your TMJ joint, can you just open and close your mouth for me? Good. Very good. And next I'm going to feel your sinuses. I'm just going to push on them and let me know if you feel any pain at all. I'm going to start with your maxillary sinuses. Any pain?
Nope.
How about your frontal sinuses?
Nope.
And next I'm just going to look at her facial symmetry. And her eyes, ears, nose, and mouth are all symmetrical. Can you smile for me? Good. Her smile is equal. Can you blow out your cheeks? Good. And stick your tongue straight out at me. Perfect. Fine. Good. Next I'm going to look at your ears. Just looking for color. It looks good. Any push on your tragus?
Nope.
Good. This side. Any pain?
Nope.
Good. Next thing I'm going to do is a whisper test. I'm going to whisper a couple words into each ear, and I want you to just repeat the word for me. Okay?
Blue.
Boat.
Boat. Green.
Good. Then same thing on this side. Pink.
Pink. Flower. Curtain.
Good. And then the next thing I would do if I had an ophthalmoscope is to look at her internal auditory canal and also her tympanic membrane. And next I'm going to skip down that to her eyes. So first just looking, look straight ahead. Her eyebrows are equal, eyelashes look good. I'm just going to pull down. I want you to look straight up. Good. And then look down. Good. And next thing I'm going to just look at your pupils. I just want you to look straight forward at my nose. I'm going to shine the light. Our corneal light reflexes, good. And just keep looking, check your pupils. Good. Good. So her pupils are equal, round, and react to light. So now I want you to focus on my flashlight. And then when I tell you to, you're going to look over my shoulder at the wall behind me. So go ahead, look at the flashlight, and then look at the wall. Good. And her pupils also respond to accommodation. So next we're going to check her ocular muscles. So just using your eyes, I want you to follow the movements of my flashlight. And I don't have a Snellen eye chart, which I would use to check her visual acuity, and I also don't have an ophthalmoscope, but I would lower the lights and check her red reflex, and also check the internal structures of her eye with that. So we're going to move on to the assessment of her nose. So looking at it, her nose is symmetrical, her septum is medial. Can you blow out for me? And out. Good. So both nostrils are patent. Now I just want you to close your eyes, and I'm going to have you tell me what this smells like.
Yeah, alcohol. Yes, I know.
Okay. Alright. And then I also don't have the otoscope, but I would put a speculum on it and look into each nair to look at her turbinates and the internal mucosal of each nostril. So we're going to move on and assess her mouth. Okay. And I'm just going to use this as a tongue depressor. Looks nice and pink and moist. Can you say ah? Good. Her uvula is midline and it moves freely when she says ah. And I'm just going to look. Can you pick your tongue up to your upper mouth? Looks good. And I'm just going to look in your cheeks. Perfect. Looks good. Then I'm just going to move on and check your neck. So first I'm just going to feel anything abnormal. I'm going to feel your carotid pulse. And then just for the midline of your trachea, which does appear. Good. And then I'm going to check the range of motion of your neck. Can you tuck your chin to your chest? Good. And bring it back up and extend backwards. Good. And then tilt your ear to your shoulder. And the other side. Good. And then turning your head side to side. Good. Good. And then can you shrug your shoulders? Lift them up. Good. Next, I'm gonna test your strength. So I'm gonna push. I want you to push against my hand. Good. And the other side. And then try to shrug your shoulders. Good. Next, I'm gonna check your thyroid. So I have a glass of water for you. When you tell you to, you're just gonna take a small sip and swallow it to help me locate. So just tilt your head a little forward and a little to the right. And go ahead and swallow.
Oh.
Good. Next, I'm just going to lift your shirt up in the back.
Oh.
And I'm just gonna look and feel your spines here. And I just want you to repeat the phrase 99 for me.
99.
And again,
99.
again,
99.
again,
99.
and one more.
99.
Good. And then I'm just gonna listen. I'm gonna have you take some deep breaths in and out for me. And go ahead and just keep going. And one more. Good. And then we're going to do the same thing on the front. I'm just going to reach this nice deep breath for me. Okay. And another deep breath. And one more. Good. And then I'm just going to be listening to your heart, so just breathe normally. And then, Mrs. M, if you don't mind, I need to have you lie down here for me.
Yeah, okay.
And she was able to get up independently.
Oh, first I was getting laid down because my hip. Okay.
Okay.
Yep. I
Good.
have to get it straightened out.
Okay, take your time. So I'm just going to listen to your heart again. So just breathe normally. And I'm just going to listen with the bell on my stethoscope. And is it okay if I pull your shirt up a little bit to see your belly?
Mm-hmm. So you can find it.
And I'm just going to listen to your bowel sounds. You have good bowel sounds in all quadrants. So I'm just going to look at your stomach and feel.
Not there.
Just gonna push a little deeper. Next, I would inspect Mrs. M's breasts. We're not going to do that on video, but I would have her lift her arms overhead on her hips and just look for any dimpling, restricted movement. Also check her nipples for any kind of discharge. I'm also not going to inspect the inguinal area on camera, but I would feel for her femoral pulses. So we're going to go on to do evaluation of her lower extremities. So I'm just going to roll your pant legs up and take a look at your legs.
I should take that thing off.
That's all right. And she has fine hair distribution on both legs. I'm going to just bend you up slightly, feel the pulse up and down here. Okay, if I take your sock off?
Yep.
It doesn't look like she has any swelling in the lower extremity. You can relax that one. Just bend this one up a little bit for me. Take your sock off. Good pulses. And again, I don't see any signs of swelling. I'm just going to look at her toes. A little bit cool to touch. Her nails look good. Same thing here. Now, are you able to take, go ahead and straighten it back out. Take your heel here and slide it down your shin. Good. And the same thing on the other side. And then with your ankle, are you able to pull your toes back and push them forward? That's your ankle. And same thing here, back. Good. And push forward. Same thing with your toes. Flex them up towards you and point up and point down. Good. I'll help you put yourself back.
Thought you put them on. That doesn't feel hot behind my knee, does it? Okay.
Now I'm going to help you sit back up.
Okay.
All right.
It's the hip that does it.
And then we're just going to check some sensations. So I'm going to pull your pant leg up just a little bit again. And your arms as well. So this is sharp. This is dull. I want you to close your eyes and just tell me which you feel. So what is that?
Sharp. Dull. Dull. Sharp. Sharp. Dull.
And keep your eye closed. I'm just going to touch you with a cotton ball. I just want you to tell me when you feel it.
Now. 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 Now.
Very good. And keeping your eyes closed, I'm going to put something in your hand. I want you to tell me what it is.
A pen.
Very good. You can open your eyes. So next thing I'm going to do is check your reflexes. Now I don't have a reflex hammer, but I would use the arm, relax it here, and check her reflex here. Also her radial reflex on both arms. Again, supporting it at the tricep, the radius, And then with her feet dangling more, I would also check her patellar reflexes here and at the back of her ankle as well. So the last part of our exam, I need you to stand up and you're going to be doing some walking for me.
Okay.
I'm just going to move this back out of the way. So if you can start here. And I just want you to walk straight towards me. Just assessing her gait for steadiness. Good. And go ahead and turn around. And this time I want you to try to walk touching your heel to your toe.
Oh.
Good. And go ahead and turn around. And I want you to just stand with your feet together, nice and tall. I'm going to be here. I just want you to close your eyes. And we're going to assess for any swaying. She's good. You can go ahead and open your eyes. And then if you just take a little step forward for me, I'm going to check your range of motion. So if you could just go forward like you're going to touch your toes. And if you're okay, I'm just going to feel your spine while you're there. A little bit of scoliosis in the back. And go ahead and stand up. And kind of arch back towards me if you can. A little bit limited. And back up to center. And then kind of tilt side to side. Good. And the other side. Good. And then can you rotate? So twist your shoulders back.
Oh, back.
Good. Yeah, just like that. All right. Very good. And that completes my physical assessment. Thank you.
You're welcome.